Hello everyone, how are you today? I hope you're doing very well. Alright, so in this video you are going to learn about nursing handover. Okay, let's get started. Start from the definitions. Handover is a change of shift when the outgoing nurse gives a report to the nurse on incoming shift. Or we can say that handover is the transfer of professional responsibility and accountability for some or all aspects of care for a patient or a group of patients to another person or professional group on a temporary or permanent basis. So remember, handover is called as a change of shift report. So the point is that to describe the client's health status and letting staff on the next shift knows exactly what kind of care the clients require. Now we move to the types. There are 4 types of handover. The first, verbal handover, or we can say it is face-to-face or oral handover. So it is directly reported. And the second is tape recorded handover. A tape recorder is to give report to the next shift. And bedside handover is a kind of handover that is done beside the patients. And the last is written handover. Now let's talk about the framework for handover. We have ISPAR. I for identity. So you have to identity yourself, your role, and your passion. S for situation, and you have to state the patient's diagnosis or reasons for admission and their current problems. And then B for background. You have to know your patient's history or clinical background or content. A for assessment. And here you have to know your patient's current problems, observation, and treatments. And the last are recommendation. This is post handover plan including request and risk. What do you recommend or want the person you call to do? Be clear about request and time frame and repeat to confirm what you have heard. Okay, this is an example of a verbal handover and case. We have Nurse Meti and Nurse Anna. And remember, in this meeting, you are learning verbal handover or oral handover. And this is the expression on how to do verbal handover, the green one. I'd like to tell you about all the patients in this ward. Start from this one. Okay, and this is the case. Alright, and now look at the analysis from the conversation. We have this Good afternoon. My name is Nurse Matty. I'm a nursing student from university. I'm here to do the shift handover. And John Smith is 45 years old. So this is identity. The first one is identity of the nurse, and the second is identity of patient. And the next, he had traffic accident on the way home from work. He was admitted to the emergency room at 2300 hours on the 7th of November 2016 is a situation, and he is a heavy smoker. He is addicted to coffee. He got bronchitis last year. It's called as a background. And the next, his blood pressure was 135 over 65 millimeters mercury at 1300 hours. All his dressing has been changed at 900 hours. He consumed morphine and antibiotics this morning. He was given injection to prevent clotting, and his pain was manageable with medication. This is assessment. And the last one, Dr. Singh requested him to stay in the hospital for another 3 days. He needs observation and some tests regarding some memory losses. He should visit therapy session every afternoon at 1600 hours. Okay, this is the last slide. So you can see the table here. This is the summary of the handover. Well, now let's continue. In verbal handover, you will also learn simple past tense when giving reports, and you will learn active and passive form. Okay, you can study these sentences. Okay, so here we have 3 sentences. Mr. Chu drank vitamin C this morning. Mrs. Jane gave injection to the patient an hour ago, and Kim and Ron visited Andy in the hospital yesterday. These 3 sentences show that they are in active sentences, while this orange color shows that the sentences are in passive. The vitamin C was drunk by Mr. Joe this morning. The injection was given to the patient by Mrs. Jane an hour ago, and Andy was visited by Kim and Ron in the hospital yesterday. You learn the pattern of simple past tense in positive and negative. First, in positive sentence. For active, we use subject, verb to, and object. When it is changed into passive, subject, the object becomes the subject, and then the verb here becomes was or were with verb 3. And remember, was is used for singular subjects and were for plural subjects. And the last is by agent, by someone. The subject here for the active, from the active, it becomes agent, by agent in passive. See the example here. Subject, Miss Lira. Verb 2, reviewed. Object, the patient's file. When it is changed into passive, then it becomes the patient's file was reviewed by Miss Lira. Okay, do you get it? Now, look at these examples. Mr. Danny prepared the medication in the medication room this morning. The medication was prepared by Mr. Danny in the medication room this morning. The doctor treated the patients 2 hours ago. The patients were treated by the doctor 2 hours ago. Okay, next. We will learn the negative. Active, subject, did not or didn't with verb 1, and object. For passive, subject from the object of the active. And then we use the same was or were, and with not because this is negative, and plus verb 3. And the last is by agent. It's from the subject of active sentence. See the example here. Subject, Miss Lira. Verb, did not or didn't review. Object, the patient's file. The passive, the patient's file wasn't reviewed by Miss Lira. Okay, now look at the examples. They didn't give the injection to the patients last night. The injection to the patients was not given by them last night. He didn't make reports yesterday. And here it becomes the reports were not made by him yesterday. Well, now it's time for you to do this exercise. You can write down the answers in your book. Later, you can check the answers. Okay, now you can check your answers. Well, I guess that's all, everyone. Thank you for watching.